Good afternoon, everyone. My name is Wadia, and I'm the communications manager for the World Health Organization European Regional Office. Welcome to this press briefing from Kyiv. It's wonderful to have all of you here in the room and several of our partners joining us online as well. Today we have with us Dr. Hans Kluge, the WHO Regional Director for Europe and Central Asia, and we also have with him Dr. Jarno Habicht, who is the WHO Ukraine country head. Dr. Kluge has been here for the last several days, going to several sites around the country, and he will now talk about what he's seen and his message for the government and the people of this country. Over to you, Hans.
Thank you. Доброго дня. Good afternoon. As I wrap up my 6th visit to Ukraine since early 2022, my key message today is simple and urgent. Ukraine is approaching its third winter amid full-scale war, likely its most challenging. A renewed focus on health is more critical than ever, from government, WHO and donors. A renewed focus along the lines of response, recovery and not least reforms. As of today, WHO has confirmed close to 2,000 attacks on health in Ukraine, including hospitals, health workers and patients. In just the past 6 months, targeted attacks have damaged Ukraine's energy infrastructure. Frequent summertime power outages are already taking a toll with danger signs for the winter. For example, by jeopardizing the storage and distribution of vaccines, if vaccine stocks cannot be used, we could see a rise in vaccine-preventable diseases. Or water systems could be compromised, as water distribution sites depend on uninterrupted power supplies. This could lead to increased water and foodborne diseases. A lack of wintertime heating and ventilation systems could contribute to a rise in respiratory infections, from influenza to COVID-19. And this is critical. The threat of antimicrobial resistance within the context of war and humanitarian disaster. As the Ukrainian war drags on, with wounded people needing urgent treatment, there are rising concerns over drug resistance through possible antibiotic misuse. We have stories of wounds that simply will not heal as a result of resistance to antibiotics, which is a situation with possible consequences well beyond Ukraine if drugs are rendered useless. In response to concerns over power supplies, WHO and health authorities are accelerating efforts to install generators and other crucial equipment at health facilities nationwide. For example, recently we launched a heating unit at Chuhuiv Central Hospital in the Kharkiv region, a facility near the war's front line, severely damaged in 2022, which I visited this week. This is just one of 15 such heating units that WHO is installing in 8 regions. In tackling the danger of antimicrobial resistance in the short term, Ukraine now has 100 laboratories carrying out surveillance on drug-resistant bacteria, compared to just 3 in 2017. But consistent monitoring is key. I will be addressing the issue at the upcoming United Nations Global High-Level Meeting on AMR in New York in less than 2 weeks from now, together with the Ministry of Health of Ukraine. Another wintertime concern in Ukraine is the risk of heightened mental health challenges. Already an estimated 10 million people are at risk of mental health problems, ranging from mild to severe. With the war approaching the 3-year mark, such challenges are only increasing, and the realities of the winter season could worsen the situation. The National Mental Health Program, led by First Lady Olena Zelenska and supported by WHO, has been scaling up rapidly, but demand still far outweighs.
Recording in progress.
Moving from immediate response to longer-term recovery, our latest health needs assessment in Ukraine showed that 8% of households do not have access currently to a primary healthcare facility. Access to medicines is another challenge. More than 80% of all households say they encounter problems in obtaining the medicines they need, with 6% saying they do not have access to essential medicines. And 1/3 of respondents said they do not have enough money to buy medicines. Now, ahead of winter, primary healthcare is being prioritized to bring health to where the people are living, including in the communities near the front lines. This week, WHO launched a prefabricated primary care clinic in Chokhodarivka, a rural area of the Odessa region, to provide basic services to almost 2,000 people and to improve the medicine supply chain, despite persistent challenges. By the year's end, as winter truly sets in, we will have installed around 40 such modular primary healthcare clinics in 6 regions. It is a true example where response and recovery go hand in hand, as the facilities ensure primary care services will be available for the coming years. I also visited an inspiring physical rehabilitation unit in Poltava, supported by WHO, where well-trained therapists are providing life-transforming services to patients of all ages. Ukraine's national rehabilitation program has made impressive progress in a very short time. Unfortunately, the longer the war continues, the more the need there will be for prosthetics and physiotherapy. Another example I witnessed this week was the frontline city of Kharkiv, where the regional government is speeding up health system recovery. Health facilities crippled by the war are being refurbished, including enhanced security measures to adapt to constant shelling, and new services are being added on to address a range of chronic diseases from cardiovascular disease to cancer. It's truly an example of building back better. The immediate response to the wintertime needs and longer-term health system recovery are ultimately tied to Ukraine's ongoing health reforms. The process began well before February 2020, and remarkably, the country has managed to push ahead despite the war. Health reforms feed into Ukraine's stated priority goal of accession to the European Union. Under this, a range of indicators must improve, including linked to tobacco control and efforts to tackle antimicrobial resistance, just 2 priority areas in which the Ministry of Health is pushing ahead. To conclude, let me stress again how vital it is that Ukraine's health system withstand and surmount the challenges of the impending war and the impending winter, including attacks on health that are a clear violation of international humanitarian law. Any attacks on health and healthcare are completely unacceptable. Ukraine needs health and security. Security from attacks, from vaccine-preventable disease, from antimicrobial resistance, from a range of issues that compromise health and well-being as we head into the winter. Health is the glue that holds societies and countries together. I end with heartfelt thanks to all the donors and partners who support Ukraine's quest for health for all, no matter what. And ultimately, our greatest gratitude and admiration to the heroic healthcare workforce of Ukraine, to the Ministry of Health under the leadership of Minister Viktor Lashko for their determination and courage. Now, Dr. Jarno Habicht, the WHO country representative, and I are ready to take your questions. Дякую.
Thank you very much, Dr. Kluge, and we will first go to the room for any questions that we might have from the media partners over here. Please feel free to raise your hand and open your microphones and ask your questions. Also, a simple housekeeping note, if I may, in case we have to, for some reason, evacuate from this room because of an air raid siren, there is a backup that we have, and we will all shift over there. The link for that will still be the same Zoom link that you have for this current event over here. So with that, over to you for any questions from the room. If not, I do have a question about... Yes, go ahead, please.
Ірина Маркевич.
Ivana Markevich, 1+1 channel. Can you tell us, do you see as of now regions or oblasts of Ukraine or separate districts of Ukraine where it's impossible to provide healthcare services in winter because there's no electricity or no water and so on and so forth, or just there's no conditions or utilities to provide healthcare services? Have you seen regions or parts of the districts like that? Thank you.
Thank you. I will start and then give to Dr. Jarno Habicht for some details. The latest health needs assessment that WHO performed together with the Ministry of Health showed that 8% of the whole country, 8% of households do not have access to primary healthcare facility. So this is physical access. But there is a big issue also of financial affordability. More than 80% of all the households say they encounter problems in obtaining the medicines they need. 1/3 of the people who responded to our assessment said they do not have enough money to buy medicines. When we were in the beginning of the week in Chokhodarivka, I asked the community what were the biggest needs, and the elderly ladies who were present were mentioning pharmacies, the medicines, because access to get to the health facility can be a challenge. There's no public transport, it's private transport, so the medicines themselves. But here the Ministry of Health is working on some very innovative solutions, like mobile teams and other innovations that maybe Jarno, Dr. Habicht, you want to say something?
Thank you. And WHO has been doing surveys during the whole 2.5 years plus time of war since Russian Federation invasion on 24th of February 2022. What we see across the country is 93% of facilities can provide the services. But situation is difficult in some of the regions like Kherson, Mykolaiv, Sumy, particularly Kharkiv after attacks on the energy infrastructure. So, of course, there are areas where access to care is more complex. Overall, we know that Ukrainians every day live without electricity around 6 hours out of the 24 hours. And that's why also the attacks to the energy infrastructure will put healthcare facilities under the risk that not all the services can be always available. And that's why it is important to ensure the autonomous electricity, water and heating as the winter preparation is coming. As Hans Kluge also mentioned, since the beginning of war, the financial barriers have increased. If we compare to February, March, April 2022, when people had security concerns, now many have concern about financial means. We know that 1 out of 4 households are living under the poverty line. We know that there are less means available, and we know that the prices of medicine and other goods are going up. So, of course, we see that as the war goes on, the health needs are increasing and barriers are increasing, but the health system is functioning as we go ahead. I would like to mention one more aspect, is the healthcare workers, especially in the frontline oblasts. It is important to ensure that there are sufficient nurses and doctors available. And that's another very important aspect that we need to address in the coming months. Thank you.
Thank you so much, Dr. Kluge and Dr. Habicht. We have a question online from the Polish Press Agency. Please open your mic and please ask your question. Go ahead.
Hello, can you hear me?
Yes, please, go ahead.
Regional Office for Europe WHO has detected the polio outbreak in Ukraine, detected in October 2021, and it was officially over. And has the situation with polio is up to update? Did it manage to maintain the trends described at the time? Is there something by now with that situation?
Dr. Habicht.
Thank you. And as mentioned, in 2021 we had polio outbreak that was effectively closed by 2023. And it's a remarkable achievement because through that time, as the war was raging across the country, the public health authorities, together with partners like WHO, UNICEF, US CDC, had their teams on the ground to ensure that surveillance is in place, vaccination teams are working, and we can really close that outbreak. And what is important now, as the school year also starts, that majority of the schools have went to the offline schooling where the shelters are available in Ukraine. And that means also, because we have school-based vaccination campaigns and catch-up campaigns, that there is work to be done to ensure that all children are vaccinated. Of course, we need to ensure that vaccination rates are increasing, because that is the disruption that also Hans Kluge was mentioning about the cold chain, about ensuring vaccines to be available, and that we reach to all who need the vaccination. So as part of health security agenda, vaccination is one very important element that WHO, together with authorities, particularly public health authorities, is working currently. Thank you.
Thank you so much, Dr. Habicht. We have Catherine Fiore from Euractiv Online. Go ahead, please.
Hello. Can you hear me? Yeah.
Yes,
I hope so.
go ahead.
My question is, I'm sorry I missed the start of the briefing, but one of the issues that's been raised is access to clean drinking water, and I'm just wondering to what extent this is a worry for you. We've heard that there may be millions of people who don't have access to sanitary facilities, and particularly drinking water. And what risk does this pose to waterborne diseases in the population? Thank you.
Go ahead, Dr. Habicht.
Thank you. And it is true that because of the attacks to the energy infrastructure that we have witnessed throughout the war, but that have intensified since March 2024, and now particularly also in August 2024, they have impact much bigger than just energy. We have numerous households from Kiev as a capital, as well in other places across the country. When there are also electricity cuts, people are at homes without the water. So that's why the heating, water, electricity are very essential as we are entering to the third winter at the wartime, and we need to do a proper surveillance on waterborne diseases and raise the awareness among population as well. And here one very important aspect is also ensuring water both technical and clean water availability in the healthcare facilities. That was much of the discussions when, together with Hans Kluge, we were visiting and discussing with authorities in Dnipro, as well in Poltava and in Kharkiv just a few days ago. So it is a topic which is high in the agenda to ensure that we have proper water and sanitation in place. Thank you.
Thank you so much. We have a question from the room, in fact, two of them. Go ahead, please. Identify yourselves, if you will. Thank you.
Lily Hyde, Politico. I have two questions. You mentioned the modular clinics that you've been setting up in Ukraine. I think I read that one of these clinics has already been damaged by shelling or bombing. And I'm wondering how you balance trying to replace or provide healthcare with the fact that there's ongoing attacks. Are there some places that you decided just not worth trying to rebuild, or how are you adapting to this situation? And second, the situation on occupied territories. Do you have any information about the healthcare situation on occupied territories, especially HIV and tuberculosis? And can you comment on the reports that Russia is withholding healthcare from people who don't take Russian passports on occupied territories? Thank you.
I think this can be shared by you both. Thank you.
Thank you. And we have since 2023 installed number of modular primary care clinics, and our focus as World Health Organization has been particularly primary care, because in 2022 we saw that it is important to restore the services. We had outreach teams who were going to other side of the minefields, ensuring that civilians actually get their healthcare services, and we equipped them also with medicines. In 23 we saw, especially in the Kharkiv Oblast, to ensure that the services can be restored, these modular primary care clinics became very important. We have installed a number of them in Kharkiv Oblast as well in Sumy, and we have different types of also modular facilities for the ambulances and paramedics, particularly in Kherson. And this is exactly to bring these services closer to the community, especially because many civilians stay there. It is true, we have lost one of the modular clinics that WHO has installed, and because of that risk with authorities, after there have been civilian evacuations, we have also agreed to bring one of the modular clinics a little bit backwards, and to ensure that services are still available the closest where the civilians are living. So, as the war goes on, we need to adapt, and that's one of the lessons what we are learning as a WHO, and closely coordinating that also with authorities in Kiev, but also on the oblast where we are installing it. Let me bring one more very important aspect here with these modular facilities. As WHO works both on the response but also recovery and reform agenda, in our clinics, it's actually Ukrainian doctors and nurses working. And these centers are connected to the Ukrainian health system. So while humanitarian, it's also very important that these centers are really with Ukrainian doctors and nurses connected to the National Health Service of Ukraine, that it is building the trust that is there among the population and facilities and the doctors and nurses. So in Sumy, I was visiting one of these centers. It was good to see actually young graduates who have just finished the medical school to start to work there, mothers coming with children for the vaccination. So it works, but it constantly needs adaptation as well.
Hans, over to you.
Thank you. On the occupied territories, the Ministry of Health asked me to request the Russian Federation on the health of the healthcare workers which have been detained, to ensure that they receive in captivity the healthcare under the international rules and ultimately the release. On HIV and TB, since the very beginning of the war, have been very vocal to all parties to ensure that TB and HIV patients in particularly do receive the necessary care and medicines. Thank you.
Thank you. We have a question from the room. Please go ahead. Identify yourself. Thank you.
Katarina Hall
Катерина Галка, Esperanto TV.
continues. What kind of diseases is our country may face, and are we threatened to any epidemics?
I think this can be shared by you both. Thank you.
I think it's very, we have been very vocal since the beginning of the war as well, that neighboring countries should not feel threatened by any infectious disease or other ones coming from people from Ukraine who leave. I mean, the protocols are very well in place. We are providing a lot of assistance to Ukraine, but as well to 8 to 9 neighboring countries for people from Ukraine. But of course, there are a number of health issues which, with or without war, which are global. For example, I was mentioning on the antimicrobial resistance. Actually, the fact that the heads of state in 2 weeks in New York will discuss this means it's a global issue. I was talking this morning with the director of the Superhumans at the first Spouses Summit, where we were invited by First Lady Madame Olena Zelenska, and she was in particularly also expressing the concern if patients need reconstructive surgery, for example because of severe wounds, that infection control is difficult in frontline in some hospitals, and then it's difficult to do the reconstructive surgery if the wounds are infected by resistant bacilli, and that's something which is a global issue. But Dr. Habicht, you may want to add here.
Thank you. Every war disrupts, and it disrupts also the health services, what we have in Ukraine. Ukraine system works, but we see also areas where the services are very difficult to access. And we see also that the disease patterns are shifting. We have demographic shift. We have more elderly. We also have shift in diseases. But shift in diseases means, for me, and what we see is that there is increase of various diseases. So we see actually the rates of tuberculosis going up. We see the rates of HIV/AIDS going up. We see mental health needs. In the beginning of the full-scale invasion, we estimated 10 million people to have mental health conditions that need support. But as the war goes on, that impact might be much bigger. And this we can only evaluate, and its impact for the generations to come only when the war is over one day. Rehabilitation needs, how many amputations we need actually. So for me, we have shift in diseases, which means that the disease burden is much bigger. And various other topics that can be put there. I think very important is the question how health and security are coming together. And we need more health security in this environment, especially at the time of war. Thank you.
Thank you. Are there any other questions from the room? Yes, please, go ahead.
Марія Дрозд, п'ятий канал.
Maria Drost, channel number 5. In summer, there has been an increase in the number of coronavirus cases, and our Ministry of Health had forecasted that this fall, so like right now, this trend has to go down since COVID-19 has to be replaced by the seasonal respiratory infection like influenza and other types of diseases. Like, what do we see right now? What is the situation right now in Ukraine, and can this tendency go up as well? When the temperature goes up, will the COVID cases also go up?
Thank you. And in the past weeks, we have seen higher number of COVID cases in different facilities. Still, the rates are not as high as we had in the first year of COVID in 2020. So, but the numbers are higher. Also, we assume that the seasonal influenza will come also in the coming weeks and months, and that's why, together with authorities, we are looking particularly to ensure that influenza vaccines are available, but we call also everybody to use the opportunity for vaccination, especially those who are in the risk groups, that they have vaccination for seasonal influenza. Thank you.
Thank you. We have another question from the room. Go ahead.
Can I have a clarification question? So you mentioned before that you need to provide hospitals with alternative sources of water supply and energy supply, and other authorities are saying that they are providing the generators and everything else. Does your monitoring really shows that this is sufficient and this is enough as of now? And can hospitals fully operate on generators and on 24-hour cycle if there's no electricity at all in winter? Or do you see hospitals like regions when there are issues with that? If your monitoring have studied that aspect and if you found something. Thank you.
Thank you. We have also, as a WHO request from the government, to provide heating stations to facilities. And we have done already heating facilities for particular hospitals in Chernihiv Oblast, 2 of them, as well in Kharkiv Oblast in one of the hospitals. But more is to be done, especially in the frontline oblasts, to ensure that hospitals have their heating available. We were also discussing the same matter with Deputy Minister Serhiy Dubrov when we were in Kharkiv just a few days ago, to ensure that all critical hospitals, and there is a list of critical hospitals available from the government side, have their autonomous wells for the water available. So the work is ongoing to prepare for the winter, and we as a WHO contributing to this, but we are not only, because on the energy infrastructure, heating infrastructure, water infrastructure, the efforts are much bigger than in the health sector, because the same needs to be ensured for the schools, for the kindergartens, and many other centers. So when we go to oblast, it's a priority topic that has been raised by each of the governors that we have met. Thank you.
I think we have another question from the room, if I saw correctly. No, we don't. There is a question on the EU accession process, and what exactly does that entail in terms of criteria that have to be met by candidate countries?
This is a very important question, and the Minister made it very clear, Dr. Lasko, that this EU accession is a top priority, not only for the Minister of Health, but for society and the government. So in essence, it means that public health standards are reaching those as in European Union countries. One example would be on tobacco control. No public marketing, for example, or advertising. So tobacco is one. Another one would be on blood safety standards. Yesterday afternoon, I discussed this with the European Union Commissioner for Health and Food Safety, Madame Stella Kyriakidis, who also has been to Ukraine a few months ago. And this process is ongoing, and WHO is going to step up its assistance here. Maybe Dr. Habicht, you want to add some details?
Thank you. EU accession is a process where a number of regulations will be adopted or adjusted, as also Hans Kluge was mentioning. And this means, as mentioned, the blood, but then also on the data, the information sharing, but also various other topics. Let me bring one example, like regulating the trans fats in the food, which means that the country has a capacity to test the amount of trans fats in the food, and Ukraine is developing this capacity, and we have a number of laboratories who have developed this ability in the last year, and then ensure that also producers will adapt their production lines. So there are various elements that influence our daily life, from environment to how we actually work in the health system, as well how the data is shared, but also the regulation related to the working hours of the healthcare workers, etc. So it's a process over the next years where number of matters will be harmonized in Ukraine system as well as the 27 European Union countries have. Thank you.
Thank you for that. We have Monsieur Philippe Renier from Le Soir. Go ahead, please.
Yes, thank you. Hello, Philippe Renier from the newspaper Le Soir in Brussels. You also mentioned the need of health personnel. Is there a lack of local, Ukrainian nurses or doctors? And if so, could you put a figure on this? Thank you.
Merci, bonjour. So, the biggest crisis in health in the whole WHO European region, the 50 countries, is definitely the health workforce crisis. Of course, due to the war in Ukraine, this is exacerbated. I will give one example. We were in the beginning of the week in Chuhuiv city at the hospital, which actually was attacked 3 times by missiles. We saw it, and the chief doctor was telling that that hospital had 800 people, 800 staff, meaning 800 healthcare workers, but since the attacks, only 120 are left. So this is more than 5 times less, meaning that in the case of the chief doctor, who is a surgeon, he is literally living there in the facility, not even going home. And if you combine this with 2 years of COVID-19 fatigue, the issue of burnout and fatigue in the healthcare workforce is really very acute and was mentioned everywhere we went. Dr. Habicht, you want to add something?
Let me add that the situation varies slightly also from oblast to oblast. And WHO is finalizing a study which looks exactly where the healthcare workers are currently, but we need to look at also in light of the population movement as well, because the population numbers have also changed. We have a number of oblasts who have now less people, and then other oblasts where there is internally displaced people who live now in their new places due to the war. So, and the health system is trying to adapt to this people movement, and then as the winter is in front of us, we anticipate another potential movement of people if there is no electricity and water available where they live currently. So it's constant adaptation that has been there for 2.5 years. There are also many foreign healthcare workers, several thousand working in Ukraine, which is also supporting, especially in the frontline areas, to ensure the services. So the system is in stretch, but still working, and that's much due to the healthcare workers who are giving a lot of their time and energy, especially in the oblasts, which are much higherly impacted by the war. Thank you.
Thanks very much for that, Dr. Habicht. We've got, once again, Catherine Fiore from Euractiv. Go ahead.
Sorry, one last question. You've mentioned how the workforce is struggling. Is there a support available from EU countries, particularly in treating those who are severely injured?
Perhaps Hans first.
Yes, since the very beginning of the war, WHO established a system with the Ministry of Health, financed by the European Union, Medivac, so under the civil protection mechanism, and thousands of patients have been evacuated with complicated wounds or diseases. However, the position of the Ministry of Health, which we strongly support, is to strengthen as much as possible such a treatment facilities in the country. For example, on prosthesis, amputations, reconstructive surgery, which is really to be commended.
Do I see any more questions from the room? I don't see anything online, so if not, maybe Dr. Kluge, I can ask you for a brief concluding thought maybe something that you have seen this week that you will take away with you. Over to you.
Maybe the reflection from, as we just are coming from the First Spouses Summit, which is on children safety. There was a survey done among the children, globally and in Ukraine. What are their concerns? And the number one was on the mental health and the anxiety for missiles and landmines. And when the children were asked what they really want as top priority, it's only one thing. It's peace. Is to have no war. So the most important medicine is peace. We cannot have health without peace. And the top priority is that all these attacks on ambulances, on healthcare workers, on hospitals, urgently have to stop. This is a very clear breach of international humanitarian law. Already there is a shortage of doctors and nurses. Everyone with a white coat should basically be untouchable. Thank you.
Thank you for that, Dr. Kluge, and Dr. Habicht, thank you as well. And with that, thank you all for being here with us in person and online. And that is the end of our briefing, and I'm sure we will be in touch and have further conversations with you in the months ahead. Thank you very much. Goodbye.